My name is Axel Merseburger. I'm a professor of urology working here at the University Hospital Schleswig-Holstein, and I'm the chairman of the Department of Urology with my special interest in minimal invasive surgery and robotic surgery. One of the most important challenges is to maintain a sterile environment within the operating theater. This is very crucial for the safety of the patient and also for the personnel. Aside maintaining patient safety is very, very important. We have to communicate. We are a team, and in teamwork it is always very important to communicate throughout the aspects of the operating theater, the anesthesiologists, the staff nurses, the doctors, the surgeons. So I think here a communication is very crucial also to have a safe environment for our patients and the same for the personnel.
My name is Katarzyna Heinze. I work at the University Hospital UKSH in Lübeck, Germany, as a manager for an OR cluster, which contains several specialist departments like urology, gynecology, general surgery and thoracic surgery. The challenges we face in the OR are that all the processes need to run optimally, that the surgeries are performed on schedule, as written in the OR programme, and of course patient safety at the very foreground. Additionally, it's important that everything necessary for the surgery is available: instruments, technical devices and equipment, and personnel, so that workflows can run smoothly.
We have to deal with emergencies in the OR theater, unexpected bleedings, unexpected situations, for example, cardiac arrest. And so, for example, this gives very sudden situations where we all have to work like a good working machine, and since we are all human in the theater, communication is very crucial and important for the safety of our patients. Aside this, I think it is also very important to look at the technology we are dealing with and the equipment. Here, knowledge about the equipment and knowledge about the technology is very, very important, because as we know from working in a private environment, we need to know how a coffee machine works. Otherwise it's frustrating, and this is much more important in an example of the operating theater, where everybody needs to know how a machine, how a device, how a lamp, how a robot works in order to have a good flow of the work in the OR. Overall, the challenges of the operating theater are very complex and require a very careful planning. That's why on a daily basis we need to communicate with the staff, with the personnel, and integrate the patient, the safety and the equipment in order to run smoothly throughout the day. Well, in my specialty in urology, it is basically the same as in other open surgeries. We require very good lighting in order to see all aspects of the field. It should not be too bright, it should not be too low. We should have a good contrast in order to differentiate the tissue planes from each other and have a good working environment for us as surgeons, but also for the anesthesiologists and for the nurses involved in the surgery. There are some aspects that is important, and let me give you some examples and a handful of examples for light, what is important. One is the adjustability. You need to move the light. You need to move the light towards a specific area in the body, in the field you're operating. This requires a best brightness, but also an adjustable brightness. Also, the color of the light should not be too light, it should not be too dark, so it needs to have some warm color. And with the adjustability and the steering of the light, aside the heat prevention, so if you are working in an OR environment, in an operating theater, you move a lot, you are wrapped with your sterile equipment and the patient is heated, so additional heat should also be avoided. Those are some factors which are very important in the light equipment in the OR operating theater. Sterility is something we deal with every day, and so it needs to be cleaned easily by the cleaning personnel on the one aspect. On the other hand, it needs to be operated easily with, for example, sterile cuffs to move, because we as surgeons need to touch the light, we need to adjust the light. Or you have artificial intelligence like a voice control to say to the left, to the right, but you still need some kind of handling device. So sterility is one aspect that is very important. Aside, shadow reduction would help a lot. If we have shadows, it's hard to differentiate the tissue planes. So this is something what helps us as surgeons to have clear-cut light without a lot of shadows.
For the surgeons, it's extremely important to have excellent OR lights so that they can better detect the tissue structures and conduct surgery smoothly and more easily. Surgical lights need to be easy to move and position and to provide shadow-free light. Apart from that, the light settings must be easy for the surgeon to adjust intuitively so that they have optimal light on the wound field at all times.
A well-designed and properly positioned surgical light can enhance the surgery, can ease the surgery in the steps when the team is operating and provide more safety for the team and therefore also for the patient. Surgical lights provide the illumination necessary for the surgical team to see the surgical field clearly, which is essential for performing the procedure safely and effectively. The lighting can help to reduce the risk of errors and complication, as well as enhance an accuracy and precision of the surgical team movements. Additionally, proper lighting can reduce eye strain and fatigue among the surgical team, which can be a significant issue during long surgeries. By reducing the amount of visual strain, the surgical light can help the surgical team to maintain focus and concentration, which can improve the quality of the surgery. In addition to providing an intuitive control interface, surgical lights may also have features that automatically adjust the light based on the surgical field's characteristics. Let me give you an example. Some lights may use sensors to detect the position of the surgical team hands and automatically adjust the lighting to reduce the shadows and improve the visibility. Overall, intuitive control of surgical lights is an essential feature that can help the surgical team to conduct the procedure more easily and safely, improving workflow, efficacy and surgical precision. The surgical lights control interface should be designed to be user-friendly and responsive, allowing the surgical team to adjust the lighting without disrupting the surgical workflow. Aside, including a camera and transferring the image to a monitor might make sense for educational purposes. Yes, it's about 10 to 15 times in a larger surgical procedure that we are adjusting the lights ourselves. And this is always done by the main surgeon because we want to see the light for ourselves to get the best direction, best safety, and that's why we adjust them ourselves with grabbing to the lamp.
During the surgery, lights need to be adjusted or repositioned sometimes, especially if there is a second wound field, or in order to better detect different tissue structures. Depending on the type of surgery, that can happen 3 to 4 times, or more often. Of course, it's even more important that the lights be handled easily and intuitively, so that the surgery is not interrupted for a longer time. Generally, interruptions should be kept to a minimum to save time and keep the surgery as short as possible.
Integration with digital imaging technology. For example, surgical lights could be integrated with digital imaging technology to provide real-time visualization of the surgical field. This could help the surgical team to visualize the anatomy more clearly and improve the accuracy and precision of the procedure. With advancements in AI technology, surgical lights could potentially be equipped with AI capabilities that can automatically adjust the light based on the specific needs of the procedure. This could help to reduce errors and improve workflow in this operating theater. Another point, wireless control. Currently, surgical lights are typically controlled via a wired connection or by hand manually. In the future, surgical lights could potentially be controlled wireless without anyone touching them. Advanced sterilization features. Sterilization is a critical concern in the operating room. So in the future, surgical lights could potentially be equipped with advanced sterilization and cleaning features that makes it easier to clean and disinfect the light. Lastly, improved energy efficiency. Surgical lights typically consume a lot of energy. In the future, surgical lights could potentially be designed to be more energy efficient, reducing their environment impact and operating costs. Overall, the features of a surgical light will continue to evolve as technology advances, with a focus on improving workflow efficiency and surgical precision, and most important, patient safety.